every other week we are rotating between the revenue cycle management and the clinical issues. So today is the revenue cycle management week. So Katie, you are on.
Okay, thanks. Okay. Get started whenever we get this first slide here. So as Kemal said, my name is Katie Needles. I am a client manager here at United Medical, and I'm in the accounts receivable department. So what we really work on my side is revenue cycle management. So we do have many clients that we do the medical billing for, but more than that, we want to make sure that the revenue cycle, the entire process of seeing the patients, collecting any revenue, that it's comprehensive. The way that we're able to do that is by partnering with Cerner and Cerner resources. So we use PowerChart as our EMR. We use 2 practice management systems of SPM and CPM. So that's where they're actually going to enter the visits. And then that all interacts with QuickBase. It's a constant feedback system. So PowerChart can talk to SPM, can talk to QuickBase. Everything is able to communicate in a cycle. This is a very tiny screen, but basically this is just a summary of our workflow. So if you take a look at the top up there, we start with the doctor's office and it's going to work its way through. Whenever a charge is entered, there's many opportunities where something could go wrong. And part of my team, the goal is that we want to reduce those errors and get that claim processed as quickly as possible. The charge is going to start with the doctor's office, and from there, it's going to go to the United Medical Systems verification. At that point, it'll go through a scrubbing process. Is there anything wrong with the name? Is there anything wrong with the zip code? Any sort of a manual error that we're able to fix. After that, it's going to go through our clearinghouse, go through electronically. That's where the claims are going to be sent to the insurance. No more of all paper claims. This is all electronic, which allows us to get payments faster. After we go through that, the insurance will accept the claims. And after that, they'll come back as ERAs, which are electronic remittance advices, or sometimes on paper EOBs. This is where the insurance is going to give us a determination of what happened with that claim. Was it paid? Was it denied? At that point, my team will take over and either the payment posting department will post, or my team will work on correcting that denial. Denials can come from a multitude of reasons, whether the patient wasn't eligible. Sometimes we do have to fight with the insurance. Sometimes they're legitimate things. And unfortunately, sometimes we do have to fight a little bit to get things paid. But that's what my team works on from those EOBs. We also utilize a reimbursement manager. That's the way that we organize our claims in order to see what needs to be worked. It's a queue of sorts that we can work through those denials. All of that goes to the AR team. And at that point, we're going to chunk it up a couple different ways. Does it need to go to a secondary insurance? Do we need to bill the patient for a copay, co-insurance, deductible, or is that the end of it? But it's a whole cycle, therefore the revenue cycle.
So if they are rejected at this point, then?
Correct. So if we do have a rejection, it'll go back to the AR team and then it goes back up and goes back through the process.
Yep. So, all right. So I will clear this.
So this is our clearinghouse and our denial management. As I mentioned, part of the big thing that we do is work on rejections and denials. So on that top where it's highlighted in green, it says manage payments and manage reimbursements. We're able to work the denied claims from there. Right underneath of that, where there's that orange highlighting, we can work the rejected claims. Essentially, TriZetto is almost like a toll bridge of sorts where claims have to be passed through the scrubber and then they'll come back from the insurance. All right, so this is going to talk about our decode, our denial code correction system, and this is how we ensure precise reporting. So often insurances will come back with a really vague denial or some sort of a communication that doesn't always make sense, or they'll have a code that says PR288. So rather than presenting that to the providers, which doesn't make a lot of sense, we have a coding system called denial codes where we look at the reason why the claim was denied. Was the insurance wrong? Was there no referral? Was there no authorization? That left snippet there, that left picture is a picture of SPM. where we did put in a D code, DCVD, where we identified that COVID shots actually have to go to Medicare if the patient has a managed Medicare. What we do with this system, as you can see on the right, is we have a lot of different codes that we utilize this to report back to the client on a monthly basis of, we had 30 eligibility issues this month, or 20 patients had Medicare and we need to send the vaccines there. It's a really good feedback mechanism so that the office can identify issues that they're able to resolve on their end, which in turn will reduce denials and increase revenue. Kind of already touched on this a little bit, but SPM reporting. So we have different mechanisms for daily, monthly, and scheduling that are all going to work between SPM and through QuickBase. Some of the daily reporting will be that we use SPM to track our daily codes. So as I mentioned, those denial codes before, it also doubles as a way for us to see what our employees are working on. How many denials are we able to work through in a given day? All of this we're able to work with QuickBase, and it makes it a very easy format for us to monitor the decodes, the production, the denial rates. We also send out monthly reports to all of our clients where we compile all of those decodes and present it to them. Kemal, you can speak on the scheduling portion if you want, but I do know we also use QuickBase to assist in that as well, mostly for Krios and other clients like that.
For the on the SPM side, with the practice management portion is done through the scheduling. So it's not just the billing part, but it's also the scheduling and registration. They're all done through the PM system. So SPM is not just for the billing. That's what we have. That why we have it there. So because like many. Actually, for a second. So many practices, many revenue cycle management companies, they were not actually sharing, they were not using the same real-time systems with the billing companies, with the revenue cycle companies. So what's being used in the office versus what's used in the practices with the vendors, they were different. So because we have it all integrated with the offices, so then we don't have that problem. So we do want to emphasize that they can actually do their scheduling through the system. That's the scheduling.
In the QuickBase reporting, so we do have many different specialties that we do the billing for. Other than behavioral health and dental, I think we've done all of the different specialties that are out there. So we'll have urology, podiatry, pulmonology, we have cardiovascular, but then we have regular PCPs as well. So QuickBase allows us to separate those denials out. We're not going to compare the American Surgery Center to Brandywine Podiatry to United Medical Clinic. They're all going to have very unique issues with unique specialties. On a monthly basis, we compile those reports, as I said, and we'll look at 3-month averages to see what are the trends. We're able to separate that out by the different specialties. Each one, like I said, is going to require different setups. So the American Surgery Center is going to be very different than Brandywine Podiatry. That could maybe utilize DME or durable medical equipment for a patient's foot. They need actual physical items here. So it's really helpful for us to be able to differentiate between the types of specialties. This allows us to just really differentiate between the practices. Thank you. So for our collections process, we do implement efficient processes through SPM that identifies patients with overdue balances. Generally, we do have statements that are sent out to the patients, but after that, our collection teams reviews the accounts to assure that sufficient statements have been sent to patients prior to including them on the collections list. Our practices do have the opportunity to go through that list and double check everything, make sure that it's all up to date according to their standards before they are transferred to a third-party collections agency. This is going to result in a cleaner system. We don't want balances to be sitting out for years and years with no sort of collection. That's not really ideal for the revenue process. All right, on to client satisfaction. So our team worked really hard here, and we're always looking for opportunities to improve, but we do send out client satisfaction surveys either on a monthly or on a quarterly basis. So as of last year, our billing department has a 97.2 positive client satisfaction rating when asked if they were satisfied with the services provided by United Medical. We have a couple of nice quotes here pulled from a couple different teams. I do have a couple of mine on there, which is always encouraging to see that the providers and the office managers, that they really do appreciate the work that we're putting in here.
So I think right now we are in the last 3-4 quarters, it is 100%.
Yep, I think that's on the next slide as well. For if they're satisfied with the billing itself, it was actually at 100% with the client managers, which again is pretty fantastic and makes us feel really happy to do our jobs when we have 100% satisfaction rating. Payment posting managers have earned a 95.9% approval. And that's not that they're not at 100%, but often there's a lot more that goes into payment posting. And we're always taking the feedback from our clients to figure out what posting mechanisms we can improve on.
All right, I believe.
All right, do we have time for this one as well? Come on. Okay, so just speaking of our billing, so the point of the revenue cycle management is anybody can just do billing or anybody can post payments, but the idea of revenue cycle management is that we want to use a comprehensive system, systems that are going to talk with each other, that are going to interact and ultimately to increase revenue. So whenever we take over on a client, on average, we see a revenue increase between 5 and 15% after that takeover. We have seen clients that have gone up from that between 20 and 35% over a period of 1 to 2 years. A lot of this is because we're able to streamline that process and make sure we're looking holistically rather than chunking items up. For a client example, we had a new podiatry client that joined United Medical in April of 2018, and the client was already using the same platform. So we didn't take them from another software system. They were still using SPM. United Medical was able to increase the revenue by 32% at the end of 2019. That just really goes to show that you can be using the software system, but the unique revenue cycle approach is really beneficial for the practice. So as that last bullet, we are really focused on working together.
So I think just this past week, and this was one of your clients, what I realized, it's been almost 22 years that I've been doing this. And as I think that everything is more straightforward and more streamlined, insurance companies are more creative. So, and although the regulations are very heavy, insurance companies are finding their way to do stuff in a way that if they are able to get away or if they are not being caught, then they can do stuff. And for example, we won't mention the name, but one of the Medicaid managed care companies in Delaware is doing a prepay visit, right? Was it the prepay payment?
Essentially, they're doing audits prior to issuing payment.
It's almost like a penalty for the practice. So basically what it is that they don't pay until they receive the claim, they ask for medical records, and then they review the medical records. This is a very lengthy process. It can be, and they don't have resources. That's the other thing. They don't have the right place to send the medical records. I don't know if it's dealt with or not. And they also did not communicate this in the proper format. So, and it's against their contract with us and with the state. And this happens. So, and you would think that this happens in some third world country, but it happens in the United States. So, and that's why when we are actually doing everything that we can, and we do, this still happens in today's insurance revenue cycle management world. So that's why we have to do what we have to do at the best level that we are doing. So Katie was part of that investigation that we did with that client. And when that's needed, you need all the expertise all together. And it's not just with one person, but our entire team was there. And that's what's needed from the revenue cycle management. And Katie is one of the best managers that we have. Well, thank you for being with us. And thank you for the presentation.